UV, if I'm not mistaken, and it had a case of diarrhea.
Right? So let's start with differential diagnosis.
Narrow it down to 5 possible parasites. Would you care to list them out?
Whipworms, and hookworms, roundworms, and contagioses, and the last one is diarrheasis.
So I will elaborate on worms and roundworms. So for hookworms, the particular species in this case, which represented with the dog, would be Encyclostoma caninum. It's an intestinal parasite and it has zoonotic potential. And this parasite, it lives in the small intestine. It sheds its eggs in the feces, and once the feces is out and exposed to the environment, the eggs will larvae, hatch, and develop into the third stage larvae, which is the infective stage. And this process will take about 2 to 9 days, and it's highly dependent on the temperature and humidity levels. The puppy could have been infected via ingestion of the third stage larvae, or larvae penetration of the skin, or ingestion of other vertebrate hosts that have this infective larvae in their tissue. And there's also one more possibility. There could have been transmammary transmission of larvae from the puppy's dam, the dam to the puppies, especially in cases of Encyclostoma caninum. So what this parasite does is it will attach to the mucosa of the small intestine, it will mature, and then it will digest the tissue, and it will inject coagulants and stimulants. Once it's done feeding, it will detach and move to another site and it will reattach. And due to this will cause bleeding ulcers, and hence the diarrhea, presumably. However, if there is skin penetration, there will be dermatitis with erythema, pruritus, and papules observed at the interdigital spaces. So maybe we should observe the puppy's paws. And next will be intestinal parasite, which is the roundworm, in this case Toxopara canis. It is very common in puppies, and it's also a very common parasite amongst dogs. The puppy can be infected via ingestion of the larvated eggs. The puppy can be infected via ingestion of the larvated eggs, or in ingestion of hosts that have consumed the larvated eggs, and also transplacental transmission from the dam to the puppy. Pups infected via in utero, you can observe that they lose weight very easily, they have very poor head coat, and they have a pot-bellied appearance. And this parasite, what it is that if it migrates to the small intestine once in the host, it will cause mucoid enteritis and occasionally mild diarrhea. However, in severe cases, it can result in bloody diarrhea. Yes, in severe cases. And then if the adult ascaris migrate to the stomach, this can result in irritation of the gastric mucosal lining, resulting in action. So, I thought why don't you continue?
Yeah, sure. So the next one I will talk about the whipworms, which is the diarrheasis. So it basically inhabits in cecum and also the colon. So it will firmly attach to the wall of the intestine, the colon, and embedded in the mucosa space. So it can so when the puppies or it ingests the infected eggs, which means in the in the infective eggs, then it can develop in the wall of the ileum, cecum, and also colon of the puppies. So basically in around 11 weeks, the larvae will mature and start to and continue reproduce in the colon. So basically the mealworms will cause body weight loss and fresh bloody diarrhea since the animals will have hemorrhage in the colon, so the feces will appear fresh red color. So and it also leads to the inflammation reaction in the mental colon. And then the life cycle of the mealworms is direct cycle, so it's kind of more easier to control. So the next one would be the diarrhea, which in this case seems if being observed in the puppy could be diarrhea duodenalis. So from the name we can know that it will inhabit in the duodenum, which is on the mucosal surface. So it's basically a flagellate protozoa, and it could increase the bacterial permeability and also intra-epithelial lymphocyte number. So basically, since it also destroys the epithelium of the duodenum, so it will produce, so the host, in this case the puppy, will produce the soft coliform feces with mucus and fatty appearance because the absorption rate becomes lower. So while in case of coccidiosis, basically the pathogenesis is almost the same, but just the species become azospora or sarcoidosis in the case. So next.
So we move on from differential diagnosis to sample collection and the method of collecting.
Samples should be collected. I'll follow the differential diagnosis from Haitong and Jasmina. First is coccidiosis, where there's diarrhea. So fecal samples are usually taken, and if it's fresh, it's better. Vomiting samples are also taken, but it's rarely used in labs. Then there's blood samples taken for puppies and dogs that shows anemia. Next is giardia. For giardia, you can also do the same as coccidia, but mostly people will only take the fecal samples as they are extra liters in their samples. Then we have roundworms. In some cases of roundworms infection, in the fecal and vomiters, you can see adult worms using your naked eye. Other than that, you take blood samples for further lab tests for serums, and also urine for urine analysis. Usually, these samples of urine are taken from dogs showing anemia, abnormal liver enzymes, and also abnormal white blood cells level. But it is still not common in that test. Other than that, fecal smears, which also comes from fecal samples. For hookworm and trichuris, usually the hookworms you can also see burrowing on the skins of the dog when the dog lies on contaminated grounds. So first, check for the hookworms on the skin itself, and also hookworms do travel through the muscles. So muscle sample for muscle biopsy should also be taken. But basically, because the puppy or dog came with diarrhea, so the most suitable sample to take is fecal sample. That's all from me.
Thank you, Hannah. And for methods of collecting the samples, so we are taking the samples of the feces, which is mainly diarrhea because the case the dog has diarrhea. And what we need to do when collecting the samples, first we need to have the container. So this thing can be done maybe by the owner himself, and maybe the vet. So if it's the owner himself trying to take the fecal samples, they just have to have a container that can be sealed well. And after taking the sample, it needs to be put in a double bag to avoid any leakage. And if it's possible, we take fresh samples. And if it's diarrhea, we take the diarrhea samples as the same as how we take urine samples because it's water-free. So after it's inside the container, you seal it, and then you bring it to the bag. So if it's the bag taking the samples, it's just similarly, just put in a container and they can straight away do the tests. And if it's taking blood samples, it must be done by the vet himself, which either take from the venous veins, septic veins, or veins. Yeah. And for the muscle samples, muscle biopsy needs to be done in labs. And basically, that's just how we take the samples. So I guess we proceed with the lab test.
The result that we expected for the direct smear, usually we can detect the larvae of the trochanter, also the trophozoite stage of Giardia, and several trichomonas species that found in the stools.
The lab test that we can use is fecal flotation test. It's also used to detect if the puppy has intestinal worm. So usually the fecal sample is made with a solution that is more dense than the egg of the worm. So it is to free the egg that are trapped within fecal material. So after 20 minutes, the egg will float then to the surface. Then the surface is skimmed off with the cover slip and examined under microscope. So for the result, I shall be.
So I would like to add on, whereas the solution that we use, there is 3 types of solution, which are the sucrose, zinc sulfate, and also the sodium nitrate. These 3 types of solution indicates different types of parasites. So for this case, I would suggest using sucrose and zinc sulfate because this solution used to detect such as Toxocara and Xylostoma, Trichoris, and also Isospora. Also for the zinc sulfate, which we indicate to detect Giardia. Yeah, Giardia for this case lah. Okay.
The next one is we can do complete blood count. It's a count of the total number of cells in a given amount of blood, including red and white blood cell. This is a common test to check for the abnormalities of the blood, and it will give information on nutrition status, anemia, infection.
And because of usually in parasite infestation, we found that there is high amount white blood cell count, especially for eosinophilia. Okay. Yeah.
You can move to.
Yeah, I'm like before okay. The PCR usually we detect the DNA of the parasites. Yeah.
Okay, we continue.
Okay, so next is treatment and control.
So I explained about the treatment and control for only one disease since we are running out of time.
Yes.
So I'll be describing about diagnosis in dogs. So there are many drugs that are used in this disease to treat the fever. The first one is fenbendazole, which is prescribed for 15 mg per kg per day for 5 to 10 days. It is safe to remove Giardia cysts from the feces of the dogs, and no adverse effect can be found by the usage of these drugs, and it is safe for the pregnant and lactating animals. And the second most famous drug is the metronidazole. It is said to be 65% effective in eliminating Giardia from infected dogs. But then somehow the usage of this drug is related to many side effects, which includes acute development of anorexia, vomiting, ataxia, and nystagmus. And for the control part for Giardia cysts, the first way, the most important way of controlling is by fecal management, because as you all know, the cysts are shared in the feces and cyst can develop in the environment. So whenever we practice good fecal management, it can prevent the transmission of the disease. Other than that, infected dogs also can be bathed frequently to remove the cysts from the fur of the animal, and lastly, we can use disinfectants to clean the environment.
Other than that, I would like to add on for just now we mentioned about hookworm. Hookworm possible causes is by Ancylostoma caninum, which is we can treat it by using fenbendazole, moxitectin, pyrantel, because all these drugs are approved for the treatment of Ancylostoma caninum, and also another type of hookworm which is Unicinaria stenocephalea. Other than that, benzmycin is also approved for the treatment of Ancylostoma caninum. And nitrocanate also approved for both hookworm at 50 mg per kg in some of the countries such as in Canada. While if there is presence of anemia, it's severe, then we can use chemotherapy, can be supported by using blood transfusion and also supplemental iron, followed by high protein diet until the HGB level is normal. Other than that, it is important to control this disease in the bitches who give birth to the puppies. So the bitches also should be treated with Ancylostoma caninum for the 12 weeks beginning at 2 weeks of age. And in addition, fenbendazole also given for pregnant bitches from day 40 until day 2 after whelping, which really reduces the transmammary transmission to puppies. Other than that, for control, we actually can try to clean the things properly so that there's no any infection to other dogs in the houses. So must make sure that the area that the dog sleeps, eat and play is clean. And also, like what Sabi said just now, there's fecal management, which is very important.
Okay, so we move on to prior education and zoonotic implications. So for prior education, basically what I'm going to talk about is just how to prevent all these diseases, all these parasites from infecting the puppies and dogs and so on. So basically, like JJ said, the most important thing is about hygiene, because most of these cases of the hookworm, roundworms, they cause diarrhea, and they are also spread and infect other dogs through the contact of diarrhea or even eating or licking contaminated places where the diarrhea was. So basically, the most important thing is to have good hygiene, clean up where your dog has defecated and also have urinated. So that's the most important prevention, I think. We can go on to zoonotic implications.
Yes, for the zoonotic implications, we talk about 5 species that can possibly cause diarrhea in the puppies. So the first one is Trichuris vulpis, Isophora canis, Ancylostoma caninum, Diarrhea intestinalis, and Toxophora canis. So out of these 5, 2 of them are not zoonotic, which is Trichuris vulpis and Isophora canis. So the other 3, which is Ancylostoma caninum, Diarrhea intestinalis, and Toxophora canis, they can cause zoonosis, and 2 of them can cause diarrhea, which is Diarrhea intestinalis, Toxophora canis. And how can the humans get the diarrhea is from by ingesting the feces, like the same case as how it is transmitted between dogs. And for Ancylostoma caninum, it doesn't cause diarrhea, but it causes CLM, cutaneous larval migrans, which is transmitted by penetrating through the skin of the human. Okay, so basically that's all. Okay, so now let's proceed with a discussion, since presented most of our information.
So discussing about
Should we stop here?
yeah. I think we should stop here.
Okay, then let's stop.
that is all for us today. Thank you.